Some union workers at the Queens Medical Center Punchbowl are working without a contract. It expired at the end of last month for nearly 50 case managers and clinical reviewers, and their union is on day 4 of bargaining talks with the hospital. KITV4's Diane finds out why we need case managers and what would happen if they walked out on the job.
About 2/3 of people checking out of the hospital need what's called a case manager to help them with discharge.
They can either go to a nursing home, they can go to another hospital, they can go back to home, they can go to rehab, and all of these patients need help.
Jovanovich is one such case manager, and without her and her ilk, the outward flow would be slowed. And while nobody's threatening that just yet, she's part of the group working without a contract at this campus.
We need to take those weaknesses and turn them into opportunities.
Her union says it's fighting for about $10 more per hour.
They have not come up from their initial offer of 2% each year of a 3-year contract of an increase, and we really feel that that is not appropriate for the times, especially in healthcare.
The nurses union says 2 of the main sticking points are wages and an educational clause. That would be formalizing some agreement where nurses can take off every year to do continuing education.
Ever since COVID, things have really changed in labor, and workers are just demanding to be treated fairly now.
Ross says during COVID, hospitals started parking patients in temporary beds like these in the hallway. That hasn't changed.
If the case managers aren't at work, likely there will be fewer discharges from the hospital, which means that new patients come in, there will not be any room for them.
If Queens were my hospital, should I worry?
I would say yes.
Diane, KITV4 Island News.
The Queens Health System tells us it greatly values our caseworkers and has been actively working with HNA at the negotiation table. We are committed to reaching a contract agreement that provides highly competitive pay, promotes quality patient care, and the focus on workplace safety. In advance of the contract's expiration date, it's been in discussions with HNA since July, and those negotiations continue.